Hello again. Last video that I made was about the admission in the hospital, and today I will be talking about the femur surgery and my stay in the ICU. I went in for surgery 10 hours after the accident at about 2 p.m. It lasted for 5 hours, so 1 hour more than anticipated. In the evening, my partner got a call from the surgeon, who didn't sound very optimistic. He told him I bled a lot, that I became unstable, so they will not be waking me up, so there was no point for him to come and try to see me. They allowed me to wake up by myself, which happened at about 2 a.m., so 6 or 7 hours after the surgery. When they asked me what type of anesthesia I want and I picked general, they told me that I will have to be intubated for that, and some COVID patients developed lung problems after being intubated, so they wanted my consent to give me this medicine called Strovimab. When they administered that during surgery, I became tachycardic, and they first believed it was an allergic reaction to the medicine, but blood tests didn't confirm that. So they came to the conclusion that I became unstable due to the abundant blood loss. I stayed in the ICU for 3 days and I had my own room due to COVID, I suppose, which was great. I had privacy, it was dark, I kept the lights shut down, and I had the music blasting, and I thought the nurses were great, but looking back, I think it's because I was asleep most of the time, so I wasn't very needy, I didn't press the call button very often. The day after, the doctors came to see me and briefed me about how the surgery went. Instead of 2 small incisions, I was cut all the way from my hip to my knee, and when they closed me, they decided to leave the fascia open and just close the skin over it. That was to prevent me from having compartment syndrome. What is compartment syndrome? Well, muscles are surrounded by this tissue called fascia, which is flexible up to one point. After that point, if you have severe swelling and the fascia cannot expand anymore, pressure is building up, and that can cut blood supply and can cause permanent damage to the nerves. This is why mine was left open, but the plan was to cut the skin again and close the fascia when they were doing the tibial plateau surgery in the coming days. But the doctors decided not to do that anymore, and I was like, okay, because I didn't know what the consequences would be. But the result is that my leg looks very uneven, especially when the muscle flexes, it bulges here and there. Mentally, I was still okay in the ICU because of the morphine. I think only just once I was overwhelmed by pity for myself and cried, and one of the nurses told me, "Don't worry, pet," which made me smile because I didn't know you can use pet for people also. Physically though, I was a wreck. I remember when a nurse came in with a unit of blood and she asked me if I knew how many have I had so far, and she told me that was my 5th, which I later realized it was a big deal because that meant I lost half of my blood. Because of the blood loss, I think it was very difficult for them to find my veins, so I was poked in both arms, my neck, my groin, and one foot. The vein in my left arm got blown, so all my arm was bruised. My leg, hip, and crotch area were extremely swollen. I was absolutely deformed. I had pain in my lower right abdomen. I was telling the nurses that I'm concerned that my appendix would burst, but I think it was just pain radiating from the pelvis fracture. Luckily, they had an ice machine and I iced my groin and leg quite frequently, which I'm sure it helped. I also remember having fever, 38 degrees, and I think they gave me antibiotics. Otherwise, my vitals were pretty good blood pressure, good pulse. I wasn't allowed any visits due to COVID. The rules were that I can have visitors 10 days after my last negative test, but I have no idea if they tested me any further. Luckily, I was discharged before that. It didn't affect me so much in those 3 days because I was asleep most of the time, and when I was not, I would talk to my family on the phone, but I wasn't even capable of reading or watching a movie. That's about it. Next video will be about the tibial plateau surgery and the stay in the orthopedic ward. If you have questions, write them in the comments, and like and subscribe if you want to see the rest of my journey. Bye!